Hello and welcome to Act Early, Save Life, a special podcast series where leading medical experts break down important health concerns with clarity and care. In today's episode, we are joined by Dr. Nidhi Tandon, Clinical Lead and Senior Consultant, Department of Medical Oncology from Bengaluru, to talk about gastric cancer, what exactly causes it, how to spot early symptoms, and why timely screening can make all the difference. So, Dr. Nidhi, what is gastric cancer and why is it such a concern for public health?
Cancer means an abnormal growth of cells. So usually our body has a fine balance between the number of cells which are dying and the number of cells which are multiplying. When this becomes abnormal, cancer develops. And when it develops in the lining of the stomach is what causes gastric cancer. There are many risk factors for gastric cancers. The majority are related to our diet and lifestyle. So, food which is rich in salted and processed items, less on antioxidants like fruits and vegetables, a person who is smoking, who is drinking, these are the people who are more likely to develop gastric
So, do you
cancer.
think the incidence of gastric cancer in Indians is higher as a nationality?
It's not like that. In fact, gastric cancers are slightly on the higher side in Western population, probably also because their consumption of smoked and canned and processed food is much higher than Indian population. Having said that, the incidence is gradually increasing even in Indian subcontinent.
So, what are the early warning signs of gastric cancer and why is it that they're so often overlooked?
So, usually gastric cancers occur around 50 to 60 years of age. There are certain hereditary conditions in which it tends to occur at an early age, as early as 30 and 35, but those are very rare genetic syndromes.
Talking about risk factors, are there certain risk factors that one can totally mitigate in order to not get gastric cancer, or is it more like a combination of aspects that actually results in?
What I tell my patients and what I will tell you is that not everybody who is driving a bike with a helmet is safe from an accident, but your chances of being safe after an accident is higher if you are driving with a helmet. And similarly, if you are not smoking, if you're consuming alcohol in a moderate amount, even if you're drinking, if your diet is rich in fruits, vegetables, limited in any kind of canned and preserved food items, then you are less likely to develop gastric cancer as compared to the other people.
Who is at a higher risk for developing gastric cancer?
Long-term gastritis may develop into cancer because when there is long-term acidity problem, the cells of the lining of the stomach get inflamed or swollen in layman's language, and long-term inflammation changes the cells to an abnormal condition which may lead to gastric cancer.
How does chronic stomach inflammation or gastritis progress to cancer, and what can be done to prevent it?
What is important here is that many of the early signs and symptoms of gastric cancer are often confused with a lot of benign conditions we have. Acidity, bloating, loss of appetite, or a slight loss of weight is often either overlooked or self-treated. What is important to note is that if we catch these symptoms early, then we are able to treat them with a curative intent of treatment. And therefore, if the symptoms are lasting for weeks or months, then you should visit a doctor and get evaluated.
Absolutely. I think most people look at gastric issues with a light note, because you think it can be self-treated, it's not as serious. When do you know it is getting serious?
So if the symptoms of acidity, bloating, loss of appetite, loss of weight are persisting for weeks or months, then you need to visit a physician or a gastroenterologist, they might advise an endoscopy to find out what is the problem. It may be a benign thing like an ulcer, but needs to be evaluated. In advanced stages, the symptoms might be more severe with abdominal pain, blood and vomiting, black colored stools, but these are often late signs and symptoms.
Are there some, rumors surrounding gastric cancer? What is the number one rumor you would have heard about it?
Not for gastric cancer per se, but there is a lot of myth considering gastric cancer or for any other cancer being communicable. I have had grandparents who are patients asking whether they can hold their grandchild or feed their grandchild. I have had patients whose kids are not getting married because they have cancer, and the society is suspicious that it is hereditary. Also important in Indian population is a lot of people have this myth that a biopsy will lead to a spread of cancer, which is a complete myth. In fact, biopsy is essential to typify what type of cancer it is and lead to appropriate treatment.
I think off late on the internet, there's been a lot of discussion about using natural methods to combat, even issues like cancer. Especially when it comes to gastric cancer, do you think there are certain foods, natural remedies that could actually help in the process?
Antioxidants are found to reduce the inflammation and hence the risk of gastric cancer. So, a diet which is rich in fruits and vegetables will really help. Curcumin, which is found in turmeric that is used in Indian households on an everyday basis, is found to reduce the incidence of cancer. Anything which comes out of packets should be avoided as much as possible.
Do you think plastic also contributes potentially?
There have been some incidents where it has been reported that the use of plastic utensils or containers, especially when used in microwave, are known to release carcinogens in food items, but it has not been established I for my family avoid using any kind of plastics as far as possible.
And heating also, a lot of people attribute microwaves and regular heating of food to possibly cause gastro issues as well.
So there have been some reports again, but for microwave as well as for air fryer nowadays, but it has not been established as of today.
What practical steps can the public take to reduce their risk of gastric cancer?
So, contrary to certain cancers like breast cancer, cervical cancers, prostate cancer, where we have definite screening guidelines for the entire population, such guidelines have not been established for gastric cancers because they are rare to happen. So, anybody who has a family history of gastric cancer and who have persistent symptoms of gastritis or loss of appetite, loss of weight, recurrent vomitings, abnormal bowel movement needs to be evaluated with an endoscopy first.
So an endoscopy is the first step.
Yeah.
And after an endoscopy, is a diagnosis usually clear?
Endoscopy helps us to find either an abnormal ulcer or an abnormal growth in the lining of the stomach. At the same time, the gastroenterologist takes a biopsy of the same, and that helps us to decipher whether it is cancerous or not.
Okay.
Once the diagnosis of cancer is established, we usually follow it up with a CT scan or a PET CT scan to find out where all it has spread.
Yeah. How fast does stomach cancer actually spread?
Unfortunately, some stomach cancers are very aggressive. They have a rapid rate of growth and a rapid rate of metastasis.
Yeah.
And that is the reason most of them are diagnosed in late stages.
Can it be cured entirely? Do you have patients who are totally cancer free? After a
of
certain
course.
yeah.
But early diagnosis is the
Yeah.
key. Okay. If the patient is diagnosed in early stages, especially stages 1 and 2, we have got a good cure rate. Even in stage 3, we have patients who are cured, but stage 4 becomes metastatic when the intent of the treatment is only to control the disease.
Talking about you personally, how did you decide to choose this domain? Like, what propelled you to kind of choose to be a cancer specialist?
Unfortunately, I had a cousin who is no more with us because of an acute leukemia or a type of blood cancer. But when he was being treated, I actually went through the problems that the patients with cancer face. And that is when I decided to come into oncology.
Yeah. But talking about cancer a little bit more, what do you think are the advancements that are coming in the field? Because a lot of people say that, things have been stagnant for quite some time. There's chemo, but in a lot of cancers specifically, there's been no real advancement for patients or for the betterment of the lives of those affected by it. Do you think a major advancement is due to come soon?
Oh, yes, there are major advancements. Now we have more personalized cancer treatment. So now we can study the tumor specimen of each particular patient and look for targets for which we have a targeted treatment available. Also, we do have upcoming role of immunotherapy in many cancer. Immunotherapy will just activate your own body's immune system to fight against cancer, and therefore it is devoid of any side effects of chemotherapy. Even in the field of radiation, now we are having specialized treatments like VMAT, IMRT, where the intensity of the radiation is modulated to minimize the side effects. Even in the surgical field, robotic surgery is able to access tumor in the deeper tissue and leading to a faster recovery among patients.
And which of these advancements will be specific to gastric cancer?
Robotic surgery, targeted therapy, as well as immunotherapy have been utilized in the treatment of gastric cancers.
Yeah. And talking about immunotherapy, what does it exactly entail?
So, usually, our body has a very good defense mechanism, and as soon as a bacteria will enter inside our body, our T cells will get activated to eradicate it. But cancer cells are smart. They develop a mechanism so that the T cells are not able to recognize them as foreign cells. When we give immunotherapy, which is basically an injection mixed in a bottle of saline and administered, our own body's immunity will be able to inhibit the cancer cell growth, and hence it is largely devoid of any side effects.
Yeah. Talking about good gut health in general, what do you think are certain practices that everybody should kind of follow on a regular basis to just have good stomach health in general and, have a good digestive system?
As much as fruits and vegetables as we can take, go less on spices if possible. Anything in packets or cans, avoid as much as possible. Give a gap of about 3 to 4 hours between when you eat food and when you go to bed. Avoid smoking and drinking as much as possible.
Do you think drinking and smoking have an impact even on stomach issues? Like usually they are associated with liver, right?
Smoking and drinking both have not only impact on our cardiovascular health but also leads to lung issues, gut issues, and leads to a variety of cancers.
Would you say there is a healthy limit when it comes to drinking and smoking, or any drinking and smoking is detriment? Because, I think as a layman would think, that there are people who never had a single drink in their life or have never smoked a cigarette, but they still get cancer. There's some people who perpetual alcoholics, they might not. So, of course, that's a matter of chance. But is there a certain healthy limit that can be associated or tagged with the two?
So, up till recently, 20 gram of alcoholic content, now it varies between whether it is a whiskey or a wine, but was considered healthy. Especially, there were reports of red wine being healthy for heart. But recent reports have suggested that any amount is dangerous. Still, a moderate intake may, especially as social drinking, may be acceptable. Smoking is not healthy in any extent.
Absolutely. But now, I mean, with so much discussion around pollution, do you think like Indians are at the risk of, potentially being exposed to a lot of cancerous substances because the AQI in Delhi, Mumbai, and in leading cities in India is absolutely terrible. Like if you're living in Delhi, you're as well smoking 15 cigarettes a day, which I think changes a lot of things for health specialists as well as the general public at large. Because how are you supposed to, remain safe and conscious when you're already inhaling that amount of fume, right?
Absolutely agree. Air pollution is as good a culprit as smoking. Not only it is leading to asthma, allergies, skin and eye issues, but it is also increasing the incidence of lung cancer. Especially, we in Bangalore are lucky to have a better AQI than the other cities, but yes, it is contributing to the increased health burden.
Absolutely. Coming back to gastric cancer for a bit, do you think quality of food and food safety standards have something to do in the larger picture when connected to gastric cancer? Like the quality of the food we eat and pesticides, insecticides, more on that sourcing front.
So, chemicals are related to an increase in incidence of gastric cancers. Apart from the use of pesticides and insecticides, the preservatives that are found in food items may also increase the incidence of gastric cancer. And here comes the role of better safety analysis of the food items that we are going to consume.
So, would you say, like, people always say that eat whatever your dadi nani ate, like that is the safest. They did not have any preservatives, they didn't have anything that comes from packet. They would make everything in small quantities, not reheat it, refrigerate it, because that time, people didn't have so many modern appliances. So do you think that is a healthier way to go as a rule of thumb in general, something that you
Absolutely. And also, they would finish their dinner by sunset. So that is another, gives us a good time for gastric emptying to prevent any kind of reflux, forget about cancers. So those habits are very healthy. What is also important to note is that they would cover their carbs with protein and fiber. So a rice will be with a dal. So that is why their habits of eating were much healthier, and probably the incidence of diseases was much lesser at that time.
I think there's one more thing a lot of people talk about. There are certain food combinations that you should have and you should not have. Like, but there's so much confusion around this. People say don't have two dairy things, don't have meat with dairy, XYZ. Could you tell us or throw some light on certain food combinations that it's okay to have and some that you shouldn't ideally be having?
So sugar, I think, is the main culprit. Most of us would be consuming junk, but it would be like once in 15-20 days. However, sugar would be in our diet every single day. It may be in the form of white refined sugar, it may be in the form of fruit juices, or it may be in the rice that we are eating. So, sugar is something that we need to reduce on an everyday basis. Even if you are consuming carbs, including more and more protein and fiber with the carbs will be the right choice of how the food needs to be ingested.
Three things which you think that everyone should take away from this conversation regarding gastric cancer, about early screening, symptoms, or just, something that people should keep in mind? always?
The first thing is that gastric cancer is very much curable in early stages, and hence diagnosing it as soon as possible is the key to the treatment. Secondly, I would like to say is that though most of the symptoms are very subtle and often misleading, but if you have any persisting stomach symptoms like gastritis, bloating, vomitings, you should consult a physician to get yourself evaluated. Lastly, that is what is my thumb rule: avoid smoking and drinking as much as possible.
Yeah, I think pop culture in a way frames what people's minds are about a certain disease. And I think back in the day, people used to issue like a death warrant. Okay, I mean, you've got cancer. But lately, a lot of movies have been focusing on how people heal and the recovery and the journey and coming out as stronger, which I think is changing the perception.
I completely agree. A lot of our patients are scared to take chemotherapy because they have the perception of a bald lady who is bedridden. Because that is what they have seen in the series and movies. Well, when actually the fact is that many of our patients are able to work from home while they are on chemotherapy. So yes, the scenario is definitely changing because there are much more safer treatment options available, and also there are many better ways to manage the supportive treatment aspect of cancer treatment.
Yeah, absolutely. And I feel with the times to come, it's only getting better, hopefully. And hopefully one day we can say that having cancer is like having a cold. Maybe, you get
I would hope for that day to come as soon as possible.
Thank you so much, Dr.
Thank you,
Nidhi, for
Shreya.
clarifying all our questions and for shedding light on gastric cancer and the importance of early recognition. You've been listening to Act Early, Save Life. Join us again for more expert guidance on protecting your health and well-being. Thank you for tuning in.